Hello everyone, thank you for joining in. I'm Dr. Gorika Bansal. I'm a child and a newborn specialist and a pediatric allergy specialist practicing at my own clinic by the name of Dr. Gorika's Children's Medical Center at Green Park, Delhi. And thank you BabyChakra for having me here. It's a pleasure always. And today we shall be talking about the most favorite topic of all mommies, the baby massage. Baby massage, I'm sure all of you know a lot about it, since it's a very ancient old method, but a fabulous technique to actually bond with your baby. This method is supposed to be, in a way, it's supposed to be done in a very gentle and a soft way so that it generates a very feel-good hormone in both the baby and you, which is called the oxytocin, which helps you bond with your baby. So, since we know so much about this topic, I will be keeping it very short. We'll just be talking about the benefits of baby massage and also a few thoughts that have been being carried forward over generations and which seem to be true but are actually not correct. So we will be busting a few of these myths today, and thanks to Dabur Lal Tel for this initiative, because it's very, very important for us to know what exactly we should be doing with our babies. So to begin with, the first myth that I hear at my clinic usually is when the parent comes to me and I ask them what baby oil are they using for massage and who's doing the massage. So the answer that I usually get is that, either the nanny is doing it or the dadi is doing it or somebody from outside comes to do the baby massage and who's a professional help. So, the thought process behind this is usually that, the massage has to be done by some experienced person who actually does a deep massage, a firmer massage that actually creates a difference and strengthens the muscle of the baby. And even if the baby cries a little here and there, probably it's very effective because, it's actually stretching his muscles and strengthening it. But on the contrary, this fact is completely wrong. We should actually be massaging the baby with very gentle, soft strokes, which should be very, very comfortable and soothing to the baby. The basic reason behind massaging is to provide comfort to the baby. And, once the mother kind of touches the baby with those strokes and the baby, as I just mentioned, that releases the love hormone or the feel-good hormone, oxytocin, that kind of reduces the stress levels, reduces the levels of cortisol also, and helps in better bonding. So it can also help the mother if at all, she's suffering from postpartum depression. In that case, also this hormone is highly beneficial if it gets released in the mother. So the best bet is that the mama or the papa, daddy of the baby actually massage the baby to form that beautiful bond. Also, what is the timing that we should be massaging the baby? This is another question that I usually get asked. So, there's no fixed timing. Always follow your baby's cues. The baby should not be howling or crying while a massage. If, all that is happening, then probably that's not the correct time. Best time would be in between the feedings. For example, 45 minutes after you fed the baby. So it should not be done on a completely hungry tummy or a fully fed baby. It should be done in between the feed times, or we can also do it before a bath, or have a good bedtime routine wherein, once you start massaging the baby understands that, yes, it's about time to sleep. And you can put on nice music, soothing environment, and, massage the baby with gentle strokes and understand the baby's cues, So I usually tell my patients that we can always do a gentle hello stroke, wherein, you kind of tap the baby's entire body from head to toe gently and see how he reacts. So if he's happy, smiling, or interacting with you, maybe he's all set for the massage. But if he starts to stiffen or he kind of, starts crying or howling, that means he does not want a massage right now and probably pick up another time. So this can be a useful technique. And as I said, crying is definitely a big no-no. Just stop whatever you're doing there and then and just hold the baby up in your arms, cuddle him and shush him. So that's myth number one. Now, myth number two usually is that, I also have heard that we can reshape the structure of the nose or the head by massaging. So, applying firm pressures on the nose and, making it a little point. You can sharpen the nose by applying firm pressure on the nostrils of the baby. But honestly, please do not resort to any of this because it can actually be detrimental and can cause injuries because the baby is very gentle and sensitive. The bones are very soft. It can actually cause injuries than doing good. And accept the baby the way he is. His facial features are going to be evolving with time. And also, the facial features or the body growth, everything, the head shape is all determined by the genetics of the parents and the baby. So, it's all God gifted. So accept the baby the way he is, and his facial features will keep evolving, but do not resort to any sort of, firm massaging on the nose or the head to alter the shape, because we just cannot do that. Now, myth number 3 that I also hear is that, there are certain oils that are available in the market that can actually make the baby's skin fairer. So as I just said that, having a baby is a gift, and accepting the baby the way he is and loving the baby is the most important thing than thinking about the color. And plus, initially the baby might look a little more darker and pinker, because at the moment he cries, he might even turn blue or even dark brown. So wherein, you feel that, oh my God, my baby actually does not look that beautiful. That's because of the increased hemoglobin levels in the baby. And with time, the hemoglobin levels come down. Also, there is sometimes jaundice in the baby, so that also leads to altered skin pigmentation. So, baby's color again evolves. A melanin pigment in the baby actually evolves on its own with time, and is again based on the genetics and the environment. You cannot alter it with any sort of oil. Now, myth number 4, what we hear is that, the oiling of the baby should be done liberally all over the body. And oil can also be put in the nose or the ears or even navel. So that again is not true. We should refrain from doing that, because all these are dark spaces. They are warm, moist spaces. And if we put oil in these areas, orifices, then we can introduce fungal infections or bacterial infections. So again, refrain from putting any sort of oil in the nostrils or the ears or the navel. Oil is just a lubricant, it's just a method to just, reduce the friction between your hands and the baby. And it does not do any sort of, good in terms of complexion, in terms of, shaping the baby's structure, or per se, does not lubricate all these areas. It's not really needed. Now, coming to myth number 5. So usually, we think that the baby can be massaged immediately after birth or any time after birth, because that's what they love the most, and it's going to improve the growth of the baby. Yes, that's correct. Although there is no general guidelines to it, but the general consensus says that we should be resorting to massage after about 15 to 21 days of birth. That is about 2 to 3 weeks after birth. Why is that so? Because, the baby's skin is 5 times more sensitive and delicate compared to an older baby's skin or an adult skin. So, applying any sort of oil can actually irritate the skin or even cause acne neonatorum. So we should not really be in a haste to start massaging the baby. And second, there are temperature instabilities when the baby is born. So it's not a great idea to immediately start massaging. Maybe, once the cord falls off, the baby's skin becomes a little more strong and tougher. That's when you start massaging the baby. And as I said, what kind of oils we should use for the baby massage? Usually the oils that should be used should be vegetable oils, which are edible, because, if the baby actually takes the hand into the mouth, it does not cause harm to the baby. Thirdly, they should be non-scented or non-perfumed. So these are a few things that you should always keep in mind. And, oils that are rich in linoleic acid, for example, coconut oil, safflower oil, sunflower oil. These oils are nicer compared to the oils that contain oleic acid, which is there in olive oil, or even mustard oil. So, these oils, the linoleic containing oils are much more moisturizing, much more beneficial. So resort to these oils, and always do a patch test, just apply to a small area of the baby and see how his skin reacts to it. And if there are no rashes and the skin is absolutely normal, that's when you go ahead and start massaging. And always follow a good routine, wherein, the moment the massage starts to happen, he understands that this is what I'm supposed to do. It's about time, and I can go to sleep. And you can play a nice white noise music in the background, and have a warm environment, temperature of about 24 to 28 degrees Celsius, and just lay the baby down on a nice warm towel, a soft cotton towel, and ditch the nappies probably, and just lay him down and do the massage in terms of a long axis and cross axis, gently on the arms and the legs, and on the tummy and the back, and maybe giving some tummy time would be really beneficial. And all babies usually cuddle up in the uterine environment when the baby is inside the mother. So they're all usually cuddled up when you see them. So try opening up whenever you're massaging the baby. So from head to toe and from the heart to the hands. So it should be a gentle way, and never forget massaging the soles of the baby in terms of thumb spirals on the soles and the palms, because that's very, very relaxing. And they also have some acupressure points that can actually relieve the teething thumb pains, and also aid in digestion. So doing all of this would be helpful. And once you're done with the massaging, it would be a good idea to always wipe off the excess oil from the hands of the baby, because that's what they love putting in their mouths. So we don't want all that oil going into them. So always remember to do that. And whenever you're massaging the baby, sing to the baby, talk to the baby, because your voice is highly soothing and is actually music to the baby's ears, and it will really do wonders. So that was about the myths that we usually get to hear from parents about baby massaging. And now coming to the benefits. So, as you all know, as I just mentioned, that it, of course, soothes the baby and calms the baby, number one. Number two, massaging also has been seen to improve weight gain in the preterm babies. A study that was done had been done to compare the babies. In a few, there was no massage that was done, and the other set of group, these babies were well massaged. And it was seen that these babies were developmentally better, and they had a better weight gain. And how does that happen? Probably, once the baby gets soothed, the bonding is better, the breastfeeding rates go higher up. Secondly, the metabolism also slows down a little, because cortisol, or the stress hormone, increases the metabolism. So that all that probably builds up for the weight gain. Thirdly, of course, it, as I said, it aids in digestion. So, doing certain massages for digestion, which I'll just be sharing with you, can actually relieve colic, gas, or even help in constipation in these babies. So, things like tummy spirals. So, you keep your two fingers and start moving in a clockwise direction around the navel, and then keep going farther. So, and then place your palm. So that you are in the direction of the large intestine. Or you make an inverted U shape starting from the right side, so that again we are moving the gas or the air out of the intestine. Thirdly, doing exercises like putting the legs up on the tummy and then stretching out, doing bicycling, then toes to the nose, then twisting the trunk of the baby. All of this is highly beneficial. And of course, tummy time, as I just mentioned. So whenever you're massaging the back, always lay the baby on the tummy and then gently stroke the back. So that kind of, all of this tends to release a lot of gas that is stuck in the tummy, and can be very, very helpful. Also, it has been seen that babies who have jaundice tend to outgrow jaundice earlier on, as add-on therapy, not like the main therapy, of course. For example, how does that happen? Is because once you're massaging the belly, the poop gets evacuated easily, and so the bile pigments that are excreted in the stools or the urine of the baby gets excreted out of the body faster. So that's how it probably helps in jaundice. And also, baby massage बहुत ज़्यादा, as I said, bonding में help करता है, बच्चों को security देता है, eases out the anxiety in the babies. And also, massaging basically, as I said, improves the levels of improves the breastfeeding rates as well. So the better the bond, the better the baby. The moment this massaging happens, the feel-good hormone gets released, mother feels relaxed, increased breast milk supply, and better improved breastfeeding rates. So all these are great benefits of massaging, and I would really recommend all the mommies out there, go ahead. I know it feels scary sometimes कि इतना छोटा baby है, इतना delicate, and how do I massage? I do not know, and let the nannies or the grannies take over. But no, please do not do that, because as I said, the moment you hold the baby, the touch is the biggest, out of the five senses that we have, the no smelling, the vision, etc. Touch is the most well developed in a baby, and the moment you give that to him, he understands, and he kind of gets really, what I gets very relieved, and it gives a lot of sense of security in the long run as well. So go ahead and be very, very motivated. And as I said, stray away from all these myths that you keep hearing, uh, and just do the right thing. And always follow your baby's cues, because he's the boss and he leads you. What he wants to do is what we do. So I hope I kind of addressed a few of those queries, and let's just take further queries if you have any. I would be happy to take them on. All right. So, hi Rekha. Rekha has asked, I heard that Dabur Lal oil darkens the skin of the baby if used in massage. So, Rekha, so as I just mentioned that, this again is a myth. No oils can actually make your baby fairer, or neither can they darken the baby's skin. They are just lubricants to the skin, so that it entraps the moisture, and it does not let the skin become drier. So as I said, resort to oils that have linoleic acid, because they tend to entrap the moisture even better. So as I said, coconut oil, or even the sesame seed oil, all these things actually are good options. But any such thing, do not buy into it. Do not kind of think that your baby can actually become fairer or darker with a particular oil. That's not true. So Lakshmi Mishra is asking, my baby is 6 months and he always has cold. Is it okay to massage him in winters and also to add some on his scalp? Yeah, so that's a very, very good question, Lakshmi, and I'm glad that you asked it. See, normally there are massages that can actually also help in the congestion. So massaging the chest, giving some vibratory motion to the chest and the back can actually loosen out that phlegm. And also, on the face, usually we do not recommend that you massage the head, especially on the soft spot. Because, also there is another myth that I had also heard was you put oil on the soft spot, so that kind of helps in earlier closure of it. But that's completely incorrect. The soft spot usually closes on its own by about 18 months. So do not fiddle with it. And usually we say do not massage the head also. Preferably massage the head on the sides. So, gentle massaging on the scalp, like, just running your fingers down would be a good idea. Just like you shampoo the baby, that's how you massage the head. And whenever there's cold and cough, in that case, what you can do is you can place your fingers around the forehead. You can just spread them out and then pull them down to your nose and then spread it on the cheeks. So that is kind of going to release the phlegm around the sinuses and probably give him some steam inhalation indirectly. So that can also help in easing out the congestion to a great extent. But as I said, the chest massage and also massaging the toes and the soles can also help in relieving the congestion. So during cold, yes, do not unclothe the baby completely if you think that the temperature outside is cold, or you can have a nice warm heater with a humidifier in the room, and then probably unclothe the baby and do the massage, because that's going to be very soothing and relaxing. So it can actually be helpful. Okay. Pratima. So what is the right way to massage baby? Okay, so Pratima, hi. So the right way, as I just mentioned, Pratima, the baby is going to guide you through if you're doing the right way or not. Because if he's crying, howling, means he's probably the pressure is too much, or he's not in a mood to get the massage done. If the pressure is light and he's enjoying it, that's when you know that we are going the right way. Now, to summarize, I will just say that, best is to always start the massage from the head to the toe. As I said, just run your fingers through a gentle hello stroke to find out first. And if the baby is comfortable, in that case, you can first start out with the legs, because the baby is very used to his legs being handled. You know, हम diapers change करते हैं तो legs को open up करते हैं, तो they understand कि legs they do not get really fussy or irritated. So you can start with the legs in a long axis and a cross axis, and then with thumb spirals on the soles. That will be wonderful. And then you ascend further on, and then you can probably go on the hands again, as I said. So the limbs first, and then you can then do the tummy massage. Of course, should not be done on a well-fed tummy, and not so we'll always remember that. And then, as I said, in a clockwise direction, just start massaging around the navel, and bringing it down, and then stretching the navel, and then inverted U. So all of that is going to be helpful. And of course, finally, the back massage. And once you lay down the baby in front, then you just take your hands from the chest, from the heart area to the hands, and then just open it out nicely to the world. So like, you're just telling the baby to just open up and relax, because mommy's around, and there's no fear and no, no worries at all. So, and probably sing a nice song alongside, because your voice he's been listening to ever since he was in your womb. So that will be great music to the ears. So, yeah. Okay, so Varsha. Hi, Varsha. She's asking, hello, doctor. My child gets red spots after bathing. Is it because of the massage? Okay. So, Varsha, honestly, it's very tough without having a look at the spots. What exactly is it? But, there are certain kind of rashes that develop in babies after birth, that's called erythema toxicum in our language, which is basically a flea-bitten rash. Chote-chote lal dane honge, red dane honge, and basically on the face and the trunk area mein zyada hoga. So this is very, very commonly seen in majority of the babies, and ye apne aap theek ho jata hai. But yes, certain oils, certain chemicals that we use on the skin, like soaps, etc., or even the bed sheets that we're using, and the detergent reh jata hai, that can actually irritate the skin, because it has been seen this is nothing but an allergic response to the atmosphere of the baby's skin. So, agar aapko lagta hai ki after, as I said, always do a patch test and see. Agar patch test ke baad kuch rashes appear nahi hote and the baby's skin is absolutely soft and smooth and supple, in that case, you can surely continue the massage. Usually, we recommend that you use a vegetable based oil and stray away from mineral oils, because they can, of course, definitely clog the pores. The wood definitely हमें नहीं use करने हैं. And also mustard oil in some cases have been seen to cause allergenic reactions on the baby's skin if the skin is sensitive, if the child is atopic as well. So in that case, these two oils maybe you should not resort to, but rest of the oils you can surely use, but after doing a patch test. Okay. So Rachna is asking, are ingredients safe in Dabur Lal oil for my baby? My baby is now 8 days old. Okay. So Rachna, honestly, Dabur Lal oil, I mean, the ingredients are mainly herbal, I believe. There's sesame seed oil and a few others. And as I said, sesame seed oil is a good oil. You can surely use it. But always, every baby is different. His skin is different. And you cannot generalize it that, can we use a particular oil for all babies. I'll say coconut oil is the safest bet. But yes, you can surely go ahead and use the Dabur Lal oil on your baby's skin and see if there are no reactions or no rashes, then you can continue using it very, very well. No problem at all. Pushpa. So Pushpa says, is it safe to start the massage to newborn? I'm going to deliver by next week. And what are the things you need to keep in mind, doctor, for massage part? Okay. Hi, Pushpa. So all the best for your delivery, and I'm sure it's going to be a great ride for you. Massage, as I said, do not be in a haste, in a hurry to start massaging the baby. Let the baby get used to the external environment a little. Let the cord fall off and let him get comforted. And once all of this has happened, usually the cord falls off for about 7 to 10 days. So massage usually 15 days onwards is what I usually tell in my own practice. 15 days to 21 days onwards आप massage शुरू कर सकते हैं. And जैसे मैंने कहा, आपने ही करना है massage या फिर father ne karna hai baby ke, and go slow on it, and take baby steps, and you will enjoy the process. And as I said, massaging initially can be done before bathing the baby, because it will not rob the baby's skin of the oils. So आप पहले baby को massage करके, and then you can just bathe the baby with normal water, so that will, you know, remove the excess oil also and entrap the moisture in the skin also. So that's a very good way to do it, especially in the babies in the initial few months. And of course, maintain a good room ambient temperature. That's very, very important, because these babies are very, very prone to hypothermia. ठंड मतलब इनको you know temperature instability से बहुत chances होते हैं, तो उसका हमें बहुत ज़्यादा ध्यान रखना है. What things do I need to keep in mind? So I just told you, and yes. So Purva is asking, any special tips to make massage easier and best for my kid? Okay. So Purva, yes, the best tip would be that, you know, keep the massage very short and simple. Keep it to about 5 to 10 minutes maybe. Do not extend it for a very long time. You know, take the baby's cues, keep interacting and keep understanding from his facial expressions how he's enjoying it or if he's not enjoying it. Thirdly, you know, since massaging also ensures deep sleep in the baby, in that case also we should preferably do a massage before the bedtime and have a good bedtime routine. You know, the moment the baby is, we think that it's about time for him to sleep, dim the lights, you know, have a nice cozy environment with the music on, and maybe some essential oil in the room can actually even soothe the nerves even further on, and then start massaging the baby and start singing a lullaby. So all of these rituals will actually help you further on, you know, to kind of do the sleep training for the baby, you know. Another little thing that I like to add here is babies initially are going to be all up at night, and then they'll keep crying and howling and demanding for the milk, and then mein pura soenge. So, you know, this cycle usually continues until 2 months. Sorry, and we cannot do much about it. But 3 months and onwards, the baby understands that the diurnal variation, you know, that what is day, what is night. So that's when, you know, at night you kind of dim the night lights completely, and during the day keep the room well lit, so he understands. And of course, do this bedtime ritual, and you know, this will definitely ensure that the baby learns to sleep on his own without you waking him up at night anymore. And you don't have to really wake him up to feed him frequently once he's crossed the 3 month mark and the weight gain has been nicer. So always consult your pediatrician before doing the sleep training. But massaging definitely goes a long way in helping us with the sleep training. Okay. Andrea is asking, are there any times when I shouldn't massage my baby? Okay. So hi, Andrea. Nice. Thank you so much for that question. Yes. So basically, you know, if you, as I said, all babies are different with different skin patterns. So if you think your baby's skin is very, very dry and rough, and you know, reacts to any sort of little stroke, you know, you kind of, when you're bathing the baby and you kind of put the towel and you wipe the baby and his skin actually turns all red and there are lines, that means this baby has a very, very sensitive skin. In those cases, I would recommend that you please consult your pediatrician before choosing the oil for your baby for massage, whether we actually need to use an oil for this baby or we need to use an emollient cream, you know, a good moisturizing cream, which is meant for skins for sensitive babies. So, you know, in general, mainly such babies should definitely be screened by a pediatrician, and then we should resort to massage. Otherwise, majority of the times, babies take on to this massage in a very nicer way, provided it's not very deep and firm pressures. If there are gentle strokes and at the right times, they usually tend to enjoy a lot, and we don't really need to take any such precautions. But yes, in preemie babies, preterm babies, and low birth weight babies, do not resort to massages early on, as I said, because they're very, very prone to hypothermia. So always talk to your doctor, and once they give a green signal, that's when you start doing massage. Okay. So Revati is asking, can we apply some pressure while massaging the baby? So Revati, as I just mentioned, if you were there with me in the talk, that pressure is a big no-no. We don't want to make the baby a wrestler or a bodybuilder. And per se, muscle building does not really happen. It's just the stimulation of the nerves, especially sometimes the vagus nerve. That kind of aids digestion as well. Secondly, stimulation of the muscles, improves the blood circulation, and of course improves the breastfeeding rates and improves the weight gain. So these are the benefits that we are looking at, and of course soothing the baby and making them more secure individuals. So these are the benefits that we're looking at. So applying pressure really does not serve the purpose, and further on annoys the baby. The experience, if it kind of is continuously a bad experience for the baby, the moment you would come with the oil, he would just start howling and crying, and he would not want you to massage him. So we don't want all that happening. So best is to just have fun and let the baby have some fun with only those gentle touches and strokes. Okay. Mahesh is asking, hello doctor, as a father, how can I help in my baby massage? Is it okay if I do the massage to my baby? Wow, wonderful, Mahesh. Thank you for pitching in. I always tell my parents that it's just not kangaroo mother care; it should be kangaroo father care as well. You should be an equal parent, and what better time than this? And this will also ease out your stress as well. So as I said, sometimes take turns while massaging. So 2 days maybe the mommy can massage, 2 days the daddy can massage, and holding him next to your bare skin also will be very, very beneficial to bond with the baby. And because baby wearing again is an ancient old method like baby massage, and both these techniques actually have been seen to reduce the NICU stays in babies and improve the weight gains. It has a lot of benefits, and even building up the immune system. So I'd say please go ahead, no two thoughts about it, and whenever you're feeling comfortable, just go ahead and start massaging the baby. But yes, ensure that the pressure is definitely lighter. That it's just a very, very gentle touch, because even while holding the baby, it might be very light for you, but may not be for the baby. So follow the baby's cues and then move forwards. Okay. Kavita is asking, is dabur oil good for babies in winters? Do we give oil massage daily? Okay. Hi, Kavita. So, Kavita, I have just answered that. Dabur lal tel, as I said, I have per se, I mean, it's a herbal based oil, and the only oil that you need to stray away from is the mineral oil, as I just mentioned, or maybe the mustard oil also for small infants, small babies. But yes, you can resort to it, but let your baby guide you better, the skin guide you better. And secondly, winters, I would say that keep the massage maybe on alternate days, or if you want to do it daily, in that case, ensure the temperature of the room is good, preferably around 26 to 28 degrees, and have a nice warm heater with a humidifier, and then probably can keep the massage very, very short, and do not completely unclothe the baby. Maybe so one single part at a time. So if you need to do the legs, just take the pajamas out or the nappy, keep the baby out of the nappies, and maybe have a quick dry underneath, and then just quickly massage the baby and then clothe him and keep going upwards. So that's how you should be doing it. And always preferably check the baby's temperature on the hands and the feet. If they are warm, that means baby is completely warm even during the massage. If you feel they're getting colder, then please cut short the massage and then clothe the baby and wrap the baby up. Okay. Okay. Swadhin is asking, hi ma'am, from which month can we start massaging? All right. So Swadhin, hello, and I would say that within the first month itself, you can start massaging. As I just mentioned, that probably around 3 weeks. So 2 to 3 weeks के period के बाद आप बिल्कुल मसाज शुरू कर सकते हैं, and बस उसको हमें short रखना है ताकि baby enjoy करे, and right timings पे करना है. मतलब image अगर the baby is extremely tired, overtly tired, or it's about time that he's going to be napping, in that case, do not resort to all of this. So have understand preferably, in between the feed timings, somewhere around 45 minutes after a feed, after he's being fed, or before a bath, or even maybe after a bath. Babies love to sleep after a bath, so you can massage the baby and then put him off to sleep. So yes, you can start the baby on massage in the first month itself. Okay. Prachi is asking, doctor, in monsoon, is it okay to do massage? Yes, Prachi, very much okay. But yes, because we are more prone to developing fungal infections around this time. So best would be to not use too much of oil, and preferably before a bath, because after we bathe the baby, we kind of wash off the oils, excess oils. So that will actually not lead to fungal infections building up on the body, and because of the excess humidity, there's more sweating also. The heat and the humidity can all build up and lead to fungal infections. So depends on the skin. If you feel the baby's skin is pretty moist, in that case, maybe ditch the massaging and just do normal massaging without an oil. As I said, oil is only a lubricant. You can also do a massage with simple hands and without using any cream or any moisturizers, because it's just to lessen out the friction between your hands and the baby's body. So you can also do that if you feel like, and you think that your baby's skin is highly hydrated and moist. Okay, Rajesh is saying, where is a good place to give the massage? Okay. So Rajesh, as I said, the entire body, but barring the genitals, barring the face, and barring the soft spot on the head, all the areas can be well massaged. And you kind of start from head to toe, or maybe to, as I said, do the gentle stroke and then start ascending up from the legs to the body. That's the best way to do it. Okay. Radhika is asking, how long does a massage take? So Radhika, so usually, as I said, some babies really love the massage and they love the experience and they just wanted to go on and on. So, it depends on your baby completely and thoroughly. But usually we say that keep the massage short for about 5 to 10 minutes with the music on. And so the fact of the matter is that, both you and your baby should be enjoying it. It should not become very cumbersome for you or the baby. And so maybe keep it short and simple, and just enjoy the process. Okay. Sonali is asking, should I massage my baby every day? So Sonali, I would say you can even massage the baby twice in a day. Totally depends on you and your baby, how he's taking it. And massaging always comes with its benefits, usually never a downside, except for, skin rashes, if at all they react to the oil. But usually massage is always a welcome thing for the babies if done properly and nicely. So you can definitely do it every single day. Okay. Uma's asking, when would be the best time to massage my baby? So Uma, the best time would be when the baby is not overtly hungry, the baby is not completely fed, the baby is not overtly tired. These are the 3 times that you need to completely avoid the massage. So the times would be, so after you fed the baby, maybe say about an hour, it's been an hour, and that's the time when you can massage. Or, before a bath, to, keep the oils in place. Or thirdly, you can also massage before a bedtime, before the bedtime of the baby. So these are the 3 times that you can actually do it. But as I said, the baby is the boss. Every day is not the same day. Like we have our mood swings and our good days, our bad days. Same goes with the baby. So even a fussier baby or a crying baby, just shush him, cuddle him, and then once he calms down, maybe giving a massage can also be a good idea to just soothe them out and reduce the cortisol levels. So, again, varies from baby to baby and your situations. But as I said, just always do that hello stroke, and that will help you the most and will tell you that the baby is all ready. And the only thing that you need to take care is that he's not on a full tummy. That's it. Okay, Mohit. Mohit is asking, after massage, my baby sleeps for a long time. Is it normal? Yes, absolutely, Mohit. So if the baby is gaining weight, good amount of weight, we usually say that, demand feeding is addictive. And after a massage, the baby gets usually very, very relaxed, and they usually get pushed into a very deep sleep, and it's a very peaceful sleep. So, and is also helpful in the growth of the baby. So perfectly, absolutely all right if the gain is good. And I would actually encourage that you always give a massage before a sleep to this baby. Pushpa. Pushpa is saying, Doctor, my baby cries a lot when I massage my baby. Should I stop the massage? He's now 7 months old. Okay. So Pushpa, probably the technique is wrong somewhere, or we're not catching onto the right timing. So usually, as I said, babies love it. Who does not love a massage? Even adults do, right? So even a baby should be always, they usually enjoy it a lot. But as I said, catch the right timing, and maybe, have a nice warm towel underneath, and then just dab the skin a little with the towel, and then start massaging and see how he responds. And keep it very, very short, maybe a minute or two, and with gentle strokes, or maybe, not even stretching or doing pressure. You can just tap his body gently. So that also is going to be a good bonding exercise in time. And you can probably do all those exercises. There are certain massages for strengthening the muscles, stretching the muscles, or relieving the colic and all. So all those exercises, and of course calming the baby. So if the baby is extremely fussy, and see why is he fussy first and foremost. Is it a nasal blockade? Is it a colic? Or is he hungry? Or is it the reflux, the milk coming up that's troubling him? Or is it the gum pain? What is the reason behind it? So we first comfort that baby, and then once he's all okay and he's chirpy, cheerful, interactive, that's when you think of massaging the baby and keeping it very short and simple and with very, very gentle strokes. All right. So I think that's about it. These are all the questions that we got. And anything else that you have regarding this topic, or any other queries regarding your baby, you can always reach out to me. Um, so it was a great pleasure being with you all, and happy parenting, and think that you're the best parent in the world, and keep going, and pat your backs, and give them a great cuddle, give them a beautiful time. And this is the time that's never going to come again. So make the most of it. Thank you so much.